Good morning, good afternoon, good evening, wherever you are, and we're very pleased to see you all here. Welcome to this last session of the technical series on achieving sustainable healthcare waste management. The topic of the discussion today is facility level activities managing healthcare waste. You can already introduce yourselves in the chat box. We'd be very pleased to know where you are and your name. And you can also use the chat box if you need, if you have any technical issue, and I'll do my best to help you for any technical support you may require. If you have any question during this presentation, please use the Q&A box. It's available at the bottom of the Zoom window. You can ask your question at any point, really, of the session. They will be gathered by the panelists and answered either in written or orally at the end of the session, or perhaps even during the presentation. Finally, this session is recorded as usual, and we'll share with you the links to the video as well as the slides. And well, we hope now that you enjoyed this session, and I'll give the floor to Ranjit. Ranjit, the floor is yours.
Thanks a lot, Alex, and welcome everyone to this exciting last session of the 3 series webinar on managing healthcare waste. We started the series with introduction of the national level actions, what needs to be done to plan healthcare waste management activities, and then we moved on to introduction of greener technologies. These are the LTAs, long-term agreements with UNICEF EAPRO, with 5 of the manufacturers with 3 different technologies: microwave with shredders, autoclave with shredders, and heat friction with shredders. So the last webinar was on the introduction of technologies itself, and we promised we'll come back with more actions at the health facility level, which is around 2 folds. One is the regular assessment using GAVI maturity model of the healthcare waste management, and also operation and maintenance of these greener technologies. So with this introduction, we'll move on to. So today we have threefold sessions, threefold activities. The first one is we have Moana Mwenge coming from GAVI. He will talk about GAVI maturity model and guidance for proposal planning to GAVI, and using the opportunity to get the funds for healthcare waste management. The second line agenda is we'll be inviting our LTA holders, manufacturers, to talk about the operation and maintenance, training and decommissioning of their devices. We'll have a short question and answer session after each of these 2 blocks, and then we do a quick recap of the series and what's coming next. I'll invite my colleague Ridwan from EAPRO to talk on this. So with this opening remarks, I'll invite my colleague Mwenge from GAVI. Mwenge, over to you.
Thank you, Rajit. Good morning, everyone. My name is Moana Mwenge, Senior Manager System Design and Integration at GAVI. I'm going to present to you, as Ranjit stated, the guidance for proposal planning, and this will take us through the GAVI maturity model, which we have to look at. Next slide. Next slide, Sophie. So thank you very much. So when we talk about healthcare waste management, we try to link it back to how it fits to the ISC strategy for 2021 to 2025. So the thing is that the healthcare waste management is very much linked to the ISC strategy, and it's within this strategy that we try to strengthen activities, or indeed on how we can strengthen healthcare waste management. And within this strategy, we have 6 investment priorities. And these are data visibility and use, capacity development and professionalization, fundamental infrastructure, strategic planning, system optimization and segmentation. And this is where actually the waste management falls in. And then we have smart integration and harmonization. So the IC2 strategy looks at all these 6 areas. But for this now, we're going to zero down on the system optimization and segmentation, in which the healthcare waste management also lies. So basically, as you may see, GAVI's immunization supply chain strategy highlights the importance of healthcare waste management. And this is a growing concern across all health areas, including immunization. So this is not really limited to immunization, it cuts across. And despite most countries having adopted the WHO standards and international agreements on healthcare waste management, these policies are often not strictly followed. And we'll see as we go through the maturity assessment. And we know that according to research, that it indicates that insufficient adherence to good healthcare waste management practices in many places still existing. So hence the emphasis on strengthening this aspect of the supply chain to ensure that we strengthen the healthcare waste management. Next slide. So how do we use this maturity model to determine the first steps or the investments? So you saw the 6 investment areas. So we're talking about one investment area in which healthcare waste management lies. And there are different levels at which we assess this, from 1 to about 5. And we'll see later on how we move on that. Next. So we have some common barriers and challenges to healthcare waste management. And literally, these are some of the things that have been identified over time. We're seeing constrained financial resources. We're seeing complicated change management with new equipment and practices and new technology in this area. We've seen also limited awareness and knowledge on best practices on healthcare waste management and risk. And we continue to see obsolete technologies and equipment or practices that are still in use. We are also seeing that there's lack of support supervision in healthcare waste management, and hence it brings out some of these challenges that I've talked about. Sharps management during campaigns, during campaigns, this is the time that we generate a lot of waste, for example, during immunization campaigns. And how we manage the sharps is a great concern to our work. So we need to strengthen this area of healthcare waste management. And we are also seeing some missing links to, and to have a systematic approach across all sectors of healthcare waste management. We need to streamline, we need to bring together all aspects of healthcare waste management across all sectors and not just leave it out to one. Next. Now, we have the people, processes, and technologies, and these are the many categories of the healthcare waste management. We tend to see just one area sometimes being strengthened or being focused on, and sometimes you find that it's really like on technologies that we focus on. So when we talk about the people, we look at how to identify those aspects that affect people. And these are what we expect are some of the competences of the staff that we have. We look at human resources needed to train staff and build awareness of the importance of healthcare waste management. And we need to look at how do we increase adherence to and understanding of policies and guidelines, and how we show commitment to high quality healthcare waste management. So you can see this is a very important aspect, and this was mentioned earlier on in the common barriers and challenges that we saw. Then how do we identify what processes are needed to revise or to update the things that really look at processes? Now, these are issues like national policies, budget, some guidance, and we map out the flow of healthcare waste management between clusters of facilities and to treatment and disposal sites. And this also looks at assessing the effectiveness of supervision. So if you see, these are some of the issues that we looked at in the challenges and barriers. So under these processes, we intend to see how we strengthen this aspect. And then also we're looking at how to identify the technologies that are available currently for steps of, to improve healthcare waste management. Now, this will look at some of the technologies which will include segregation and some of the potential links to private sector resources, and also to clarify the priorities for the healthcare waste management system overall. So these three areas, if we strengthen them, then we'll see healthcare waste management being strengthened in countries. Next. Now, within the three areas, we have some 6 sub-areas to assess the maturity level of the healthcare waste management system. We talked about the people. So under the people, we're talking about maybe 2 areas. So it's about awareness, training, and support supervision. And then after that, we're talking about adherence and compliance. These are the issues that fall under the people aspect. So we need to ensure that there's good awareness, there's good training. And after the training, we need to have good support supervision and ensure that adherence and compliance is being done. Then the next one, under the processes, we have 3 areas. Here we are talking about national policies, the strategic plans. Are they in place or they not in place? And then we look at, if they're in place, what is the issue on budgeting and planning? What about the practical guidance that should guide the staff? So these are some of the areas that we have to look into and make sure that these are actually strengthened. And on technology, basically, we are looking at what kind of technology and equipment is available for use. Now we're talking about climate-friendly green technologies. You will see later on from the manufacturers what they're going to present, mainly on the technology side. But the technology is not enough if we don't have these other areas of people and processes. Next. Now, how do we identify high-level gaps and potential opportunities? So we have a tool with questions to facilitate stakeholder engagement in planning for healthcare waste management. So basically here we're looking at, we review recent assessments, training records, audit or supervision reports. Then we look at how do we estimate waste quantities across all health areas. We really need to know what we are generating in terms of waste in these areas. What is our high-level update of inventory of treatment disposal equipment? We need to know what we have at the moment in terms of disposal equipment. And we take a landscape of private sector companies involved in waste management. So this is important to know who's really working into this space. And also very important, also we look at what kind of financial resources and opportunities for investments are there, because this is very important to ensure that these activities are undertaken. And how do we prioritize most immediate needs of people, processes, and technologies, and identify long-term strategic planning needs? So you see, it's all falling under the 3 main areas. And these are some of the processes that we look at. And this builds on the maturity model and system ranking. So after we assess this, then we come to a ranking stage where we see where we fall. Now, the assessment to rank the healthcare waste management looks like, as shown on the slide. This should really be a participatory process with key stakeholders involved in healthcare waste management, and should be broader than immunization, because we're not going to just deal with immunization waste and leave the others. And we have to be guided by assessment, reports, and understanding of the context, as I explained in the previous slide. Now, if you look at this, we still come back to the 3 main areas: people, processes, and technology, and then look at the different areas that I talked about. And this, depending on what we find, we have to rank each level. Is it 1, or is it 5, or is it 3 or 2? So the lowest being 1 and the highest being 5. So we rank each one of these areas. Once we get the total, and then we divide by 6, and then we get the overall score. So this is the process that you undergo in terms of trying to assess the maturity of the healthcare waste management system. There are tools which are going to be provided. The links will be provided for you to go through this. Next slide. Now, just to give you an example of a healthcare waste management maturity assessment, which was done for 25 countries. Next. So here's a summary of healthcare waste management maturity assessment findings in 25 countries. You can see here the different countries, and then we have the people, processes, and technology. And if you look on the scores, major gaps were across the categories of people, processes, and technology. Practical guidance is highest and budgeting planning is lowest, as you can see. This shows that probably there's a lot of guidance and has not been put into practice, as seen in the results. And this could be because of low budget allocation and planning associated to this. So it gives you an understanding to say, where is it that our health waste management is weak? And based on this, we can try to plan some of the interventions that we can use to strengthen the different areas. Next. So what are the recommended steps for designing and implementing the healthcare waste system? These are some of the recommended steps for designing and implementing a healthcare waste management system. What do we need to do? We need to conduct, as I talked about earlier on, conduct a high-level strategic assessment. And we look at in proposals, for example, for the full portfolio planning, the CDS funds, the HSS funds, to GAVI and other investors, we need to see how we use some of these sources of funding in terms of how we intend to plan for immediate actions to address some common barriers. So we have some areas in which we can input some of these activities and put them to be part of the proposals. So we need to ensure that we design and plan accordingly. We reinforce some of the knowledge and best practices, conduct inventory of existing technologies, etc., etc. So this is a summary of how we can go about it. We need also to identify and engage key stakeholders, as I said, broader than the immunization sector. And we consider the preferred technology and equipment. You will see later on during the presentation what are some of the technologies that are available. And then from there, you'll be able to assess which one is suitable for your area or for your countries. We need to also identify opportunities for other forms of investments and collaboration across sectors. So there are different sectors in health, and even outside of that are dealing into issues of healthcare waste management. How do we collaborate? How do we ensure that we leverage some of the investments that are available? Next. Now, when we talk about funding opportunities that exist, here are some of the funding opportunities. This is not exhaustive, but just an indication. So if you look at the different agencies, for GAVI, for example, you're looking at the full portfolio planning, you're looking at the EAF, you're looking at the COVID-19 vaccine delivery support, you're looking at different areas. And also, how do we coordinate with key healthcare waste management partners? So you find that there's a potential to put in some funding for some of the healthcare waste management that activities that we intend to undertake. So these are some of the areas that GAVI can provide. When you look at UNICEF can support with healthcare waste management situation analysis and assessment. They've done this in so many countries. They continue to do this. So they could help on that. They also provide technical assistance in partnership with GAVI. So we're working together with UNICEF to ensure that we provide technical assistance. We have also from the Africa CDC funding on healthcare waste management through Saving Lives and Livelihoods program. Also in issues of coordination with key healthcare waste management partners, this is what you would really look at and consider. Through WHO, we have the training on healthcare waste management guidance. The also funding of healthcare waste management through COVID-19 integration. You could utilize that. The Global Fund also is another partner that is really very much involved in this work. So we could probably, utilize some of the funding across these agencies and see how we can partner. You might find that maybe in one country, only one sector or one ministry is really involved in this, but like I said, we need to cut across. We need to collaborate in country and put our resources together and approach the donors so that there's no duplication. in terms of the way we are conducting our activities in country. So next, I think that should be the last slide. So basically, this is a brief summary of how you could utilize the maturity assessment. We have the tools. We'll send you the links, and then you can be able to look at that, and you can get technical support from UNICEF, WHO, or indeed any other partner that is working in this area. And you'll be able to be guided on how to develop a maturity assessment. This is something basically that shouldn't take time. You can do this in one day to get a feel of what the maturity level is for your healthcare waste management in your country. And then thereafter, plan to see what activities that you're going to undertake, whether you're going to do a full assessment now to deep dive and really get the nitty-gritties of how to fix your healthcare waste management system. Thank you very much.
Thanks so much, Mwange, for an excellent overview of GAVI support and the various understanding of the supply chain strategy and how the waste management fits into the supply chain strategy. It also serves as a reminder. I mean, healthcare waste management, again, cannot be seen in isolation. And hence, we need to, you rightly said, we need to look at the other stakeholders because the solutions has to come at the primary healthcare level. All the waste which is generated at the primary healthcare level need to be treated in one uniform manner. Thanks a lot again. May I now invite Sophie to please take us through the different O&M training, capacity building, decommissioning standards of the manufacturers in alphabetical order, please.
Thank you, Ranjit, and thank you, Mwenge. I do want to say, I see there have been no questions in the Q&A box so far for Mwenge, but if you have any that do come up down the line, please do feel free to drop them in the Q&A box, and you may direct them specifically at Mwenge or other colleagues. Now, for our next section, we'll be hearing from 4 manufacturers on operations and maintenance, capacity building and training, and decommissioning of their healthcare waste management technologies. So first, we have Burton. I'd like to invite Burton to speak. Over to you.
Hello everyone. Nice to be here at this webinar today. So my name is Yeva from Burton Technologies, and I'm with my colleague Aurelian.
Yeah, good morning, everyone. First of all, thank you so much to UNICEF and GAVI for this opportunity. Also, would like to see that we saw some friendly name and faces from other manufacturers at EcoSteril, Tesalis and Euster. Also, a special hello to all of you guys. So today for this two session from the UNICEF and after reviewing for the last session everything related to the technology that we are proposing and the efficiency, we are going to review today everything related to the operation, maintenance and training. So specifically on the device that we are proposing at Burton Technology. So the next slide, please. So just as a reminder, at Burton Technology, we are designing and manufacturing a microwave threading system, specifically designed for hospital for on-site waste treatment with capacity from 20, 50, and 80 plus kilogram per hour. So next, please. So in this slide, we would like to present all the steps from the arrival of the machine to the start of the operation. So there is 2 main steps. The first one, and all of them are important, obviously. The first one is a pre-installation meeting. So as every hospital is different, as every facility that's where we will install our machine is different, we always propose to the end user a specific meeting where we'll review all the layouts and the infrastructure checklist to install the machine. So obviously everything is coming with the technical documentation from installation, user manual, maintenance, and so on. And also all our end users have a special access to our website and a safety platform where they will have access to a library with a lot of tutorials. So there is today 50 plus video tutorials available for the operation and the maintenance of the machine. Then will come the installation of the sterile wave device. So the installation basically is taking 1 to 2 days, including the cold and the hot commissioning. What we call the cold commissioning, the unpacking, the inspection, and everything related to the mechanical and electrical connection to the machine. So if everything is set up and checked prior to the arrival of the machine, this step should take less than 1 day. Then we will do the hot commissioning. We will perform the first cycle with the operator of the hospital. We'll complete also biological testing to validate with the end user that the machine performs at its nominal condition, according to the World Health Organization recommendation. So it's really a simple machine, a plug-and-play machine, 1-2 days for the full installation. And then we will dedicate 1 or 2 additional days for the training of the operator, where we can accept obviously up to 10 trainees per session. And the training is basically done either in English or in native language when it's done by one of our partners, local partners. So next, please. So this slide is related to the, it's just an overview of the operation of the machine. And it's important to say that when we design this machine and when we also develop the PLC system, so all the interaction between the machine and the operator, we wanted to have it as simple as possible. Today, a full cycle is a duration of 30 minutes, where the operator is working between 5 and 10 minutes maximum. There is no need of a skilled operator, and we are also very proud that this machine can also promote the work of disabled operator, as we have the case in several countries. So the operator is basically present during the waiting, the loading, and then at the unloading of the device. Full cycle is automatic. It's a 30 minutes, as I explained, including the shredding and the sterilization. Obviously, we also propose, according to those operations, the full tutorial also as a reminder for the next operator who will work on the machine. So it has been also asked to review all the key maintenance requirements for the longevity of the machine. We understand that those machines are purchased for a long term. It's also important to say that in our long history, Bertin has been created in 1956. We are having this business activity since 2012, so 14 years. So far, all our machines since the number 1 are still running. And we have key importance for the training of the operator and also our distribution network. So like every industrial machine, there is several steps to follow. There is a daily routine inspection to do, like a cleaning and a visual check of all the major components. We have also a detailed preventive maintenance plan, like a car, which is something that everybody knows. There is consumable, there is spare parts. They all have estimated lifetime, so it is very important to follow carefully all the preventive programs that we are proposing with the machine. In terms of corrective maintenance, obviously, there is also tutorial, writing, and video. Each potential alarm has a code. Each code has a protocol. Each protocol has also a video tutorial. It's very important, and we will encourage all for our end user to register their product on our website. Registering the product on our website permits several things. First of all, it will permit to have an overview of all the maintenance plan done so far on the device. And it will also permit to Bertin Technology as a manufacturer to support on a hotline and on a remote assistance, as the machine is equipped with a modem, for any diagnostic and support and technical support that we could bring to the end user. The next, please. So it is, as you can see on picture, just an example of how it's look on our website when you register your machine. So we have an overview about the location, if the machine is running or not, the number of cycle, and also all the maintenance operation done on the machine. So another key importance is the cleaning. If you want this machine to operate on a long term, like any purchase, any capex investments that you will do in your hospital, it's important to take care of it. So the daily cleaning, also it's important, and we know that it can also be a challenge where we can also support is to have a proper stream, a proper waste segregation within the hospital. We encourage end user to perform periodical bacteriological testing to make sure that the machine is performing the sterilization at the correct level. Online registration, again, all your data are in the safety cloud where only the end user and Bertin technology can have access. And it permits ourselves to make a data analysis and to support the end user for the maintenance, the stock of spare parts, and the operation to plan in the near future. Next, please. This is also to highlight how Bertin is working with his network. Everything is manufactured in France, and obviously, if we want to have a steady operation everywhere we are working in the world, it's important to have local partner, local trained partner with the capacity of installing the machine, with the capacity of training people on the machine, people, hospital staff, and the capacity of performing the maintenance on the device. So every partner that we have are chosen carefully. We perform with them a biannual online workshop to make sure that they are also at the update stage of the trainings that they should receive. We also welcome them basically once every 2 years in our factory in France to perform advanced training on our device for the troubleshooting, for the mechanical, electrical, complex situation, for the technical configuration of the machine, so forth and so on. And today, it's something that we want also to highlight, which we believe it's also a support to our value network of end user. We are speaking about biohazardous medical waste. Depending about the regulation everywhere in the world, those wastes cannot be stored more than 72 hours. So it's important to have a continuous operation of our device in the hospital. And to facilitate that, so we have today 3 different locations where we support our partner and end user on the different time zone of the world, 7 days a week. So we have our headquarters in France where we are supporting all our users in Europe, in Middle East and Africa. And we have 2 regional offices, one in Singapore, supporting all our Asian Pacific operation. And we have also an office close to Washington, D.C. in the US, supporting also all operation in America, North and South. Yeah, just an example about, as I explained earlier, we have probably today 50, 55 tutorial available on our library on site. And it's something that we are also continuously improving. So basically, this is going from the how to operate the machine. So it's a basic tutorial to teach the operator and also for him as a reminder how to operate the machine, from the loading to the unloading, and also a tutorial for the cleaning, tutorial for the maintenance, tutorial to how to make the maintenance on the shredder, how to make maintenance on the electrical cabinets, so forth and so on. So all of those information are available on our website. This slide, just to highlight also to whom we are speaking to have proper installation, operation, and training on our device. So first point, important, it is a local partner. Today we are present in more than 80 countries. Every country we have a partner. It's important for us to make sure that in every places where we have a machine installed, we have a local trained partner with a service team in charge of the follow-up of the machine in the country, which can reply and make intervention within the hospital in a very competitive time. Usually we speak something between 24 and 48 hours. It's also important for us to have this local partner because they are the guarantee to have continuously a stock of all essential spare parts for the machine in the country. You know, a machine can break down like every machine. What is important is how quick, how fast, and how economical you can fix the situation. So for us, it is very important when we choose our local partner to make sure that they have the necessary stock of consumable and spare parts available in the country. And within the hospital, there is several sections to whom we are in interaction. Obviously, the bioengineering part of the hospital for everything regarding the how to implement, how to install, what is the workflow of this device, and obviously the infection control team. Also to discuss about the situation for the segregation of the waste within the hospital, also to optimize the waste segregation within the hospital and the workflow from the input waste to the output waste. All of them are receiving a specific training, which is also supported by your local partner and can be done in the local languages. Next, please. So it has been also, it's an interesting topic that we have received from UNICEF and GAVI to highlight the guidance for the decommissioning of the equipment. And obviously, the decommissioning of the equipment is one of our duty as a manufacturer. So first installation that we have done of the machine was back in 2012. So far, this machine is still running. We have work and we will explain what are the guidance, but so far we never had this experience to decommission a machine. And we are very proud to say that all the machine has been sent and working worldwide are still running up today. But in terms of decommissioning guidance, so it's important to say that this machine is composed of zero hazardous material. So there is no hazardous process to follow to decommission this machine. So the different part of the machine first, the mechanical parts, they are all made in stainless steel, galvanized steel, or painted steel. So none of them are going to a specific hazardous process. There is also zero hazardous effluent to treat. There is no specific hazardous oil or no hazardous liquid present in the machine. In terms of WEE, the waste electrical and electronic equipment. So 99% of the WEE are tagged with the recycling symbol, the Mobius strip. So there is only 2 capacitors, which are non-hazardous, that are not possible for the recycling. But all of the other e-waste from the component in the machine are recyclable. There is no specific handling procedure for the decommissioning of the sterile wave. And unless to have the basic personal protection, such as safety shoes, gloves, and helmets, there is no specific protection to follow up for the decommissioning of the machine. And obviously, it is part of a whole. In case of decommission of the machine, we will keep all the stakeholders involved in the process of all the steps of the decommissioning. So the next and last slide. Why choose Bertin as a partner for the improvement of your healthcare waste management within your hospital? First of all, you are choosing a French industrial corporation with a long-time experience. I think this year we will celebrate 68 years anniversary of Bertin technology. We have long history with dealing with international and multi-million euro complex projects. We are composed of more than 650 people, and including half of them are engineer or technician. We'll provide 7 days a week global technical support with our different locations around the world. We are not manufacturing our machine or our spare parts at the purchase order. We are continuously manufacturing machine and spare parts, which made all our machine and components always available on shelf in order to have a rapid global delivery. Today, we are present in 85 plus countries in all continents, Africa, America, Asia, Europe, Middle East, and Oceania. Each country where we have reference, we have a partner, and today we probably have more than 800 units installed worldwide. I believe also another part of our success has been to design a simple machine. The design is simple, the installation is simple, the operation is simple, and the maintenance is effortless. For more than 90% of the preventive maintenance to perform on the machine, you don't need to disassemble the machine, you don't need to have special tools to make manutention of the machine. It's human access. Most part of the maintenance process is taking less than 30 minutes to perform, and you have our support 24/7 for the assistance and the training. So I think this is all. I try to stay in the 10 minutes that we have for the presentation. So it's an overview, and obviously we'll be pleased to send you more details and to discuss further with every one of you in case you have further questions. Thank you so much.
Wonderful. Thank you very much, Aurelian and Ayeva. Next, we'll go to EcoSterile. Over to you.
Thank you, Sophie. So, hi, everyone. Good afternoon or good morning to you, wherever you are. Before diving into the main aspects and the technical aspects of today's presentation, I want just to take a moment to thank all of those who have reached out to us following last month's webinar. It actually is really enthusiastic to see your interest in doing better for the health, the environment, and the people of your countries. And of course, we're happy to be supporting you in that reflection. So really, once again, do not hesitate to be contacting us. Slide, Sophie, please. Yes. So we'll get down directly to the technical aspects, first with the operations. That is going to be pretty quick. Basically, the process to operate one EcoSterile is very simple. It requires two steps. The first is to place the bin on the scale, and the second is simply to click on the loading button. The whole process is simple, fully automated. It doesn't require much to be done, and so the operators can get more time to clean the bins, to tidy the storage area, to pick up the waste, you name it. Slide, Sophie, please. And there really is nothing more to say about that, so let us have a visual demonstration of how that looks on an Eco 250.
In the 660-liter bin is brought to the entrance of the EcoSterile machine.
We have here a weighing scale, which weighs the waste to be treated. From there, the waste is carried by the elevator into a receptacle. Then from the receptacle, the waste is shredded by a 4-axis shredder in here. After being shredded to about 3 millimeters, the waste is collected in this sub hopper. The waste is then transferred through a magnetron, where it's heated with microwaves to about 100 degrees Celsius. So the waste is received into the holding tank, which heats the waste up to 180 degrees Celsius and is held in there for 20 minutes. At this stage, all microorganisms are eliminated. The waste is then ejected into the receiving bin, which appears to be dried and shredded, and the volume reduced by 80%. This gives it the opportunity to be recycled.
What you are seeing now is a hot sterilized waste free from pathogens. Dried, shredded, medical waste. So at this state, the waste can be recycled into various products and value obtained from it.
In the 660-liter bin is brought to the entrance of the EcoSterile.
Yes, so actually, I'm really sorry. My connection got off between the two videos. I'm on field trip, so that's not always easy. But basically what I wanted to explain is that the process for all machines are automated, except for the 75, which has a manual load-in. Slide, Sophie, please. Hey, Sophie, could you just confirm to me that you still hear me?
I can hear you now.
Okay,
We've
perfect.
just played the video of the EcoSterile 75.
Okay, great. Thank you to be there to support. Yeah, my connection is not the best today. I'm really sorry about that. But yeah, basically the process is the same for all EcoSterile models. It starts with a powerful shredding, then goes on to microwave preheating, and after the decontamination time, it is ready to be reused or recycled. Next, please, Sophie. Yes, now let's talk about maintenance. So you may or may not know that most of our users are actually waste management companies, such as Veolia. So these users are operating our machines 24/7 and simply cannot afford any downtime in their operations. So one thing that we are very serious about is to provide a very comprehensive, both preventive and reactive maintenance training. The first aspect that we're going to look into is the time required for maintenance. So if you're operating your machine, let's say in 1 or 2 shifts, so that is 8 to 16 hours a day, we would recommend a 15 to 30 minutes of maintenance every day. And if you are going to operate the machine continuously, so 7/7, then we would recommend a 3-hour maintenance per week. Next, please, Sophie. Yes. So among the main tasks for preventive maintenance, you have got the control of the safety devices, the cleaning of the unit, of course, and also the control of oil levels. And about the reactive maintenance, I'm going to take 2 examples in the next slides. So next slide. Yes, perfect. So one first example is the replacement of the sensors, such as these that you see on the screen. They are placed all over the machines and they are responsible for the tracking of level, temperature, safety, and presence. For instance, there is one sensor in the feeding hopper that is going to activate the shredder only when there is waste in order to not have any unnecessary consumption. And so these sensors need to be replaced every now and then. Next, please, Sophie. And another example for reactive maintenance would be the replacement of the shredder blades. So as you know, healthcare waste includes a lot of sharp objects, such as needles, glass, syringes, you name it. And so it requires a reliable and robust shredding. And so you really want to be taking good care of these plates, especially since we are providing you with the highest quality of shredding in healthcare waste with this 4-axis industrial shredder. And on this beautiful note, I will hand on the mic to my dear colleague, Andrew.
Thank you, Lubna. And hello, everyone. This is Andrew, Area Sales Manager for EcoSterile. And I'm pretty glad to participate again in this wonderful webinar. So I will continue to delve into the operations and the maintenance points for our machines. So basically what we do is that we provide a complete training program for our users of the machines. So during this program, we're going to give them a maintenance plan. So they want to follow different tasks like daily tasks, weekly, monthly, everything is scripted in this document. Then we have the spare parts guide as well. So they can have a follow and a complete guideline of the parts description, the quantities, what is the frequency, the lifespan of each component. So they can predict actually when they have to change a spare part. And then they have the user manual, that it's the complete book that they're going to receive for the troubleshooting, to resolve problems. So everything is in this book. And as I mentioned, probably you will remember from our last webinar, for us, the most important part is the relationship that is created between the technical team of our user and the technical team of EcoSterile. So they're going to create this kind of complicity between the 2 teams so they can follow up the operations regularly. So they have WhatsApp groups, they have calls, they have video conferences. So they are keeping updated about the operations of the machine and the performance of the machine. So for us, it's very important, this strong relationship that is created from the very first moment during the installation. Next slide, please, Sophie. Then talking about the training of the operators. So it's performed in a lapse from 2 to 3 weeks. So basically the installation of the machine is pretty fast. In 48 hours, the machine is already mechanically installed. And during the third day, the electricity, it's already inset. So 3 days for the total installation of the machine, and then the rest of the time is only training. So training, evaluations, tests, everything is performed during this time. So they're going to learn about the safety, about the personal equipment, about the emergency protocols. Everything is listed. And then in the more technical side, they're going to have the list of the components of the machine, the functionality, the operation, the troubleshooting. So it's everything there. And then what is important as well is at the end, they're going to receive an official certification. So they're going to be officially certified for the troubleshooting of the machine and for the maintenance of the same. And then something that I also mentioned last time, but I would like to highlight it again, is that we provide remote maintenance. So all the machines ECOSRIL installed in the world, they are connected to a network. So we actually can access the machine and help the operator if it is needed. And this is a lifetime technical assistance, actually. So when they buy one of our machines, they're going to buy also a lifetime warranty. Next slide, please. And then I want to highlight the importance of the reporting as well, the performance and the operations reporting. So first, I would like to answer the question why it is important. So first, for all the compliance with the legal regulations, well, the Ministry of Health, Ministry of Environment, we work with a lot of ministers today. So that's why it's important for us to comply with this part as well. Then to have a production overview, it is important for all of our users to know exactly what was the production per day, per month, per year, so they can just make analyses. Then to track that production, that's important. And then, of course, for post-implementation reporting, for those projects that are funded through loans and grants, to guarantee that the completion of the project has been achieved. Next slide, please. So this is an example of the reporting that I was talking about before. So it is divided into categories. So we have first the quality reporting and the performance reporting. So in the quality reporting, the user is going to have information about the electricity curves, about the temperatures, about the exposed time of the waste. So everything that is going to warranty to the user that the waste is properly decontaminated, and to the authorities as well. And then you have the performance reporting, that is all that is production per day and what time was the first container installed or set in the machine. So the supervisor can follow up the whole operation of the machine. Next slide, please. This is the live monitoring that I was mentioning before. So this is the remote maintenance that we provide as well for our users. So actually what is happening is that the operator can just call us if he needs us to solve a problem or to support in a specific task. And then we can connect to the machine from here, from our headquarters in Belgium. And we can see what the operator is seeing well, and then we can access the machine at the request, of course. So just to give you a small anecdote, one of our farthest machines installed is in Tahiti. And, our technical staff, they are regularly monitoring the operation and performance of our machines. And they noticed that, strangely, the machine in Tahiti was not working for 2 days in a row. So we were like, oh, what's happening? Like, what's the problem? So we just called the client. We said, we just noticed that your machine hasn't been working for 2 days. It's something wrong? Can we help? And they said, no, it's okay. We're in carnival time. The machine is perfectly fine. So this was just an example. So we're like, oh, okay, perfect. So the machine was working. It's just we're just having ice party over there in the island, so that's why it was not working. So just an example of our monitoring and follow up to our clients. Next slide, please, Sophie. And this is also to go further or deeper into the performance data that I was mentioning before. So these are specific data about the accurate loading of the machine, the daily production, the average production. We can just put it per week, per month, per year, and this is going to give outcomes in statistics. So the supervisor and the manager can follow up the operation. And this is a very specific example. So the productivity per shift. So if the supervisor says, okay, the daily shift or the shift from 8 to 1 p.m., it's producing this quantity of decontaminated waste, but the next shift, it's half of it. Probably there's a problem with the operator. He needs probably more training, or there's a problem not with the machine, but with the performance of the operator. So this is going to help to go and to get a best production now or follow up of the operation. Next slide, please. And well, for the decommissioning of the machine, you're good. So basically we did that, or we wrote that because you know, like the first machine that we have installed, it was more than 20 years ago. And when our clients ask us, or the users ask us, what is the lifespan of the machine, we said, well, we truly don't know, because the first machine was installed more than 20 years ago and it's still working, still operating. So yeah, so that's basically our first answer. But of course, in the next slide, please, Sophie, we explain a little bit more how is this process. So basically, we just put it in the manual as well. It's in the book that I mentioned before, where you have all the guidelines of our machines. So we have to shut down the machine and disconnect it, of course, when the machine is going to be just discarded completely. Then it's important to follow a complete cleaning and disinfection of the parts that were in contact with the waste. Then there's a procedure specifically designed for our users to disassemble the machine. So everything is going to be disassembled following a step-by-step process. And then very important, to inventory all this process and label all the parts. And then, well, we are going to dispose all the hazardous materials, especially those that were in contact with the waste. But then most important, it's important to recycle. We are going to try to recycle as much as possible. So those metallic parts that can be founded or that can be melted and then used again, but that were not in contact with the medical waste, of course. And then very important, well, the documentation and reporting. So to maintain a detailed record of that process for the local authorities or for the ministries of environment and health. Next slide, please. And just to finish, these are some references just to show the scope of our company. We're literally everywhere with all kind of environments, all kind of operations and situations. We're in Europe, in America, in Africa, in the Pacific Ocean. So yeah, we're a little bit everywhere in the world. So that shows how our company can work in different environments all over. And well, in conclusion, our company, Castril, remains steadfast in providing consistent support throughout all facets of our clients' operations, and this ensuring, of course, their success now and into the future. Thank you for your attention.
Great. Thank you very much, Andrew and Lubna. Over to colleagues at Nooster.
Hello, good morning and good afternoon to all the participants. My name is Ledina. We've seen together at the second webinar. I'm very glad also to participate at this third webinar. Together with me will present also my colleague Gianluca from the R&D department. And with this presentation, we will provide a detailed analysis of Nooster operation and maintenance activities with a focus on the training, the preventive maintenance, the predictive maintenance, the standard operating procedures, and our ecological design of the sterilizer. Next, please. We have developed and implemented a comprehensive approach to training with a specific focus on maintenance activities. We divide the maintenance into two categories: so standard preventive maintenance with training online and training in presence mandatory in Italy at our headquarters, and a predictive site-specific ordinary maintenance through the web app, the remote assistance web app Insight 4.0. The aim of our focus is to ensure the staff understands the correct and the safe use of our technologies. Next. We provide certified training process. We guarantee the online and in-present professional training. For every Newster technical partner, is mandatory to attend the initial training, as I said, in Italy, and periodic freshing courses. Training is provided for operators, for technicians, for hospital staff, and we divide the training into different levels. We divide the training for first level operator, which is the training of operators that has to focus on the use of the technology and has to perform the daily and the monthly preventive maintenance. We divide the training for the second level technician, which is the specialized technician for the ordinary maintenance, and the one who will take care of the installations of our technologies. The second level technician can train operators also for the first level. The third level is a high skill technician for the extraordinary maintenance. Also, the high skill technician can train the technicians for the second level. Next, please. We certify the training process through digital certifications for all the training levels. We require specific knowledge for all the operators and specific skills to carry out the work in efficiently in compliance with safety measures. Next. We have also developed an e-learning platform, Docebo. This e-learning platform contains training modules which covers operational and maintenance procedures, troubleshooting, safety, new store components, and the new store cycle. It engages participants through an interactive sessions. It evaluates learning outcome and provide at the end of the training a certification. We have already translated the learning platform in 10 languages. Next. In here, I would like to give you an example of our preventive maintenance schedule. The schedule, we outline specific maintenance actions that the operator has to perform every day, every month, every 3 months, and every 6 months, summarizing every year. Next. There is a particular emphasis on the standard operating procedures for the shredding and sterilization of infectious waste to ensure the staff to use and to handle the infectious waste for a correct and safe use of the infectious waste. These standard operating procedures we require to be kept at the unit, at the sterilization point. Also, we require to be translated into the local language. Next, please. I would just like to show you some examples on our standard operating procedures. They are divided into different parts. For example, the part A will show the preparation before the shift, all the verifications, the checks that the operator has to perform. Next. There's also the part B, the loading of the machine, especially the clothes that the operator has to wear, the DPEs, also starting of the room, the confirmation, for example, for the ventilation system to turn it on. Next. And the part C, the loading of the waste, the verification of the sterilization that has been completed, and so on. Next. In here, we have for each process different instructional tutorials and different videos. We will have also for ordinary and extraordinary maintenance. Now I will switch my place with my colleague.
Nice to meet you all. I'm very happy to continue this presentation because I would like to go a little bit deeper in our solution for guarantee the best performance of our technologies all over the world. Thanks the development of integrated web app, the name is Insight, is a smart application that is included in every technologies that we provide worldwide. It is very, very useful because help the preventive and predictive ordinary maintenance and the remote assistant 24 hours, 7 days per week. This web app doesn't require a direct connection with the hospital networks because in the electrical board is included a router that can work via Wi-Fi or a simple SIM card. And this web app has 3 different access levels. One is for the end user, hospital or the public procurement. The intermediate level is for the technical partner, our dealer, our skilled person that is present locally in each country in order to provide immediately maintenance when it is required. And the first level, the administrative level, is in charge of Newster that take care for the data and for the information included in the web app. Next, please. As you can see, there is different parameters that can we check from the machine logbook where we register every cycle until the installation logbook where we register and upload the official documentation where the machine is start up, including the commissioning test, the biological validation test, and the analysis that we provide when we start up the machine. But now I would like to focus a little bit more about the spare parts. Because it's very important for us that the spare parts are online monitored and checked every cycle because the web app has a counter inside that registers every cycle of the machine, the total amount of the working hours. You need to think that when a machine is shipped from Italy abroad, worldwide, it is included a standard preventive maintenance program. For example, the blade cast iron. But I think that you know that every installation, every hospital can have a little bit difference in the material, in the quality and in the quantity of the material that we are going to sterilize. It means that also the consumption of these spare parts could be different. How can we manage this difference? How can we set up the machine according to the on-site conditioning? This we applied in this software that is able to translate the preventive maintenance in predictive maintenance, because after the first 3 changes of, for example, of the blade cast iron, we don't use anymore the standard lifetime, but the specific lifetime that arises from the last 3 changes. Next, please. For the remote assistance, as I told you, we offer a complete support 24 hours per day and 7 days per week. And also our technical partner can have the access directly on the touch panel of each machine. Thanks to the application and thanks to a simple username and password, we are able to reach in real time the machine and check what is needed by the operator, if there is something to do immediately or if there is something to prepare for the next maintenance program. What is our experience is that 80% of problem, 80% of maintenance can be provided by remote, by sample check and verification, because our machine is a mechanical machine, does not require heavy maintenance or high-skilled maintenance program, but it's important that every spare part, every consumable is online checked and verify the current status and consumption. Thanks, please. Can you go on? Next. About the ecological design, we are going to conclude this presentation. 4 years ago, we started a deep evaluation of our environmental footprint during the manufacturing and the end of life of our equipment. We choose the biggest model, Newster NW50, because it could be considered a representative size of our production that include the Newster 5, Newster 15, and Newster 30. We collaborate with the University of Ancona, and with the university, we evaluated all the phases of the manufacturing of this machine, from the supply of raw material until the shipping of the machine itself, thanks to the use of an international software that is the base for the production of a life cycle assessment. Next, please. This is the final evaluation. Consider the raw material that we use to produce our equipment. 60% of our environmental impact can be covered and can be solved by recycling of this material when the machine should be disposed of. Because 80% of our material are represented by steel, by aluminum, by copper recovery, and it's possible to balance this material and its recycling activity, and it's possible to evaluate this benefit as a sort of environmental benefit that cover our environmental impact. Thank you. Can you go on? Thank you for your attention.
Thank you very much, Lidina and Gianluca. Now we have presenters from Tesalis, and I want to, before they begin, just remind everybody to please put your questions in the Q&A box. Should you have them, you can direct them specifically at the manufacturers, and they will attempt to respond via a written response. If we have time at the end, which we may not, we may be able to answer online. Though please do respond, manufacturers, within the text box itself. All right, over to you, Tesalis.
Hello, good morning, good afternoon, good evening, everyone. Thanks for listening to us. My name is Michele Lozano. I'm the president and co-founder of Tesalis, and I will pass the presentation to my colleague Benjamin Lobe, who's in charge of Asia Pacific, who will be talking to you about our on-site treatment systems. Thank you very much.
Thank you, Michele. Good morning, good afternoon, good evening, everyone. My name is Benjamin Lobe. I am the Asia sales manager for Tesalis, and I will focus today mainly on the technical part of our units. Next slide, please. So just before jumping into the main topic for today, I would just like to give a reminder on the type of units we are manufacturing. So we are manufacturing SteriPlus and SteriShred ranges of products that are autoclaves with a fully integrated shredder for the treatment of your infectious healthcare waste. So you have the 4 units on the left side of the screen, and coming with those units, we do have a range of services for the delivery, of course, the installation, the qualification, the commissioning, startup, maintenance, and decommissioning of the units. And you do have also some examples of daily operations and maintenance operations on the 3 last pictures on the bottom right of the screen. Next slide, please. So as I am covering the Asia Pacific region, I will mainly talk about my area, but this is the same for other continents across the world. So in our case, we do have a regional office in Asia, in Vietnam, where we do have a technical team as well as a sales team. So I am personally based there in Vietnam with our technical team. And we do have, for each countries where we are working, a network of local partners, local distributors, but partners that are also totally trained and certified on our units. So they are able to perform installations and maintenance operations at any time on the units manufactured by Tesalis. They are trained in our headquarters in France. And this is the way we have performed about 800 installations across the world and about 100 in the Asia Pacific region, in our case, in areas that are located far from main waste treatment hubs. Next slide, please. So first, the 3 technical features that the unit needs to be supplied, to be installed in a hospital will be first electrical access, electricity. Second, water connection, because we are an autoclave, so we need water. And third, a drain system to drain the liquids. In terms of electricity, we do not need a high electricity consumption. We are about 4 kilowatt per cycle for this unit, the Steri Plus 40. And in terms of water consumption, we are about 90% less in terms of water consumption than a basic and traditional autoclave. And for the drain system, we need to have a drain system that is heat resistant. If we do not have access to this heat resistant drainage system, we can, of course, provide some tools that would help to deal with a basic pipe. Next slide, please. So starting from after the procurement, once the unit is ready to be delivered on site, we do have 5 main stages that will be followed by our local partner and by us as well, in order to ensure a proper installation on site. So number 1 and number 2, it will be the site preparation and the pre-installation check. This is done by our local partner that has access to a portfolio of documents and information related to the hospital that will help to prepare the site and to get the 3 features, as I mentioned previously, water, electricity, and drain system, ready for the final installation of the machine. Number 3 and number 4 will be the installation and the connection of the machine to the utilities. Number 4 will be the startup of the machine, and then the technical training to the end user. This installation, the commissioning, the launch of the unit for the first cycles, and the technical training will be also done and is done by our local partner. He is always working in coordination with our after-sales team, and our regional office team are also willing to travel on site to provide support at the same time. Next slide, please. So for the following, the next slide, we have some samples of documents that are available for the installation and prepare this installation of the future unit. So here we do have an important document summarizing all the needs we have for the units. So in this case, we have all the details for the water, electricity, and drain supply, as well as the area we need to install the machine. So everything is detailed in this document that is, of course, given during the procurement, but also that is obtained by the local partner. Next slide, please. This document is just also a sample on the user training that the end user is following. This user training is tailor-made depending on the unit, of course, but also depending on the hospital, number of trainees, and on the different skills that the operator have or doesn't have. And this can be led either in local language or in English. In any case, each point will be confirmed and referred to our headquarters. So we know that the hospital is definitely totally trained and the staff can use the unit without any problem. Next slide, please. At the installation, we also provide easy to understand documents that are generally fixed or put next to the machine. In this case, this is an example of do and don't documents that can be also adapted to the hospital and to the type of waste the hospital is used to face and to deal with. So for example, infectious waste you can treat, you can put in the machine, we can do it. However, don't chemical waste such as corrosive and toxic waste, this we do not recommend to put it in the machine. Next slide, please. Once the installation is done, then we will commission and start the unit. So there are only three steps to follow to use the unit. Number 1, we will load the waste from the top. Number 2, we just launch a cycle, press start on the software. And number 3, we will unload the shredded and sterilized waste after 30 minutes at the end of the cycle. So we have a video on the next slide on which we will have a detailed overview on how is the waste. Can we cut maybe the sound of the video? Perfect, thank you. So inside the healthcare facility, the infectious waste is generated. So we have, of course, needles, sharpened boxes, dialyzers, dialysis waste, blood bags, pathological waste, scissors, metal, plastic, gloves, PPE equipment. Everything is generated by the nurse, the doctors, the patients. Then the waste is segregated and brought to the unit that is installed at the hospital. We press start. The top door of the unit will open. The load is the waste is being loaded from the top. We launch a cycle, and during the cycle time, the operator doesn't need to stay next to the machine. We first have inside the machine a shredding process. So all the waste is being shredded in small pieces of unrecognizable waste. Solid and liquid waste are segregated inside the machine. So liquid waste can be processed inside the machine. Blood, for example, pathological waste, COVID-19 vaccine bottle remains, where we have still some liquids, can also be processed. And we have the liquids at the bottom of the machine and the solid waste that will fall down in a basket. Once the shredding process is done, then we will start to sterilize the waste, of course, but also the full unit. So everything will be sterilized by steam. As a basic autoclave, we will reach about 135 degrees during 10 minutes. The steam will penetrate in the waste, of course, but will also be in contact with the shredder and the pusher, the loading chamber. So even for maintenance operations that I will detail later on, everything is sterilized and everything is safe inside the unit. Once we reach the 10 minutes of decontamination, the steam is being exhausted. The liquids will be drained. So that is why we need a drain system. For the liquids being drained, we are the unit, and everything that comes out of the unit from the unit is safe for the human and for the environment, of course, as per the certifications that we have. The full cycle shredding and decontamination is complete within 30 minutes, and then the solid waste is being evacuated, removed from this side door to be disposed as municipal waste in a normal trash bag. We have traceability tickets that are printed at the end of each cycle. I will also come back on this later on. And this is here how the waste looks like after being shredded. So this is it for the video. Next slide, please. So when we do install and train the end user, when we install the machine and train the end user, we do have also several documents that are provided as well, such as user guides. And this poster on the right side of the screen that is also put next to the do and don't document, on which it is explained just by pictures how to launch a cycle. So even if someone cannot read the user guide, we do have this poster to teach how to use the machine with basic pictures and basic logos. Next slide, please. Coming with those tools, we do have also an extranet. An access is given to each person that has been trained. And on this extranet, we do have tutorials by videos, by photos, detailed photos, explained photos on different processes. I wrote cleaning processes, but also maintenance purposes, or just how to launch a cycle. And of course, we do have on this extranet contact numbers of our after-sales team, the local team, and our regional offices teams as well. Next slide, please. On this slide, this is just an overview of the type of information that we can have on the computer to show that it is very basic, and we try to make it very clear. So in red, you have the type of cycle that is being launched, a standard cycle, basic cycle from Tesalis. First, the loading, and then according to the moment, it's a real-time cycle process. So more little by little, everything will become red. First the loading, then shredding, decontamination, unloading, and then the end of the cycle. For real-time data, we also have the information on the current temperature inside the treatment chamber, also information on the pressure, because we are a pressure vessel. And then you have a bunch of different settings that are made just to customize the use of the unit, depending on the hospitals and healthcare facility. Next slide, please. For the traceability ticket that is being printed, so either we have it as a ticket or we can also have it through USB. This ticket can be also personalized, customized, depending on the different regulations. However, we have 5 major informations on it. First, the name of the machine, the identification number of the machine. Second, the number of the cycle, the date and time of the cycle, information related from the temperature, and if the cycle is okay or not okay. If the cycle is not okay, then the machine will lock and the local partner will have to intervene for a maintenance. Next slide, please. In terms of maintenances, there are 2 major maintenances to do. I wrote here 4 because the daily maintenance is more like part of a daily cleaning after the end of use, after using the unit. The end user is invited to take care of the unit, and when possible, between cycles, to clean the basket, when we remove the waste, or to clean the top of the machine, to make sure to ensure that the unit will last a long time, and that we don't need to perform often maintenances because we have some remains of waste being, for example, locked just at the loading door. So this is just like a basic maintenance done by the end user, just the cleaning of the unit for the number 1 and number 2. Number 2, monthly checkup can be done also by our local partner. But then we have 2 major maintenances, number 3 and number 4, every 600 and every 1200 cycles, so which is about every 6 months. Every 6 months we have a major maintenance done by the local partner that is trained and certified by us. This maintenance, in certain cases, can be done indirect by us, where we send our technical team to do it. This is the 2 major maintenances that we have. Next slide, please. In case of breakdown, and also coming with those maintenances, we have 8 tools that will help us to launch again the unit as soon as possible. First, there is the assistance of the local partner. As I said, they are trained and certified by us. They do have a stock of spare parts. They can intervene very fast on the unit to put it back on track. Second, there is our own service team from France available all week, and from our regional offices that are also available. We do have hotlines as well. All the units are equipped with Wi-Fi and 4G options. Wi-Fi, sometimes we cannot really connect the machines to Wi-Fi because in hospitals it can be restricted, but then they have 4G. So we can connect and remotely take control of the unit to troubleshoot it and know what's wrong. Then there is the warranty on the units. This is a warranty of 2 years. So all the parts will be taken under warranty if it is defective due to the unit because of us. The units are also coming with spare part kits that are done and that are here to be used during those maintenances and in case of breakdown. We have the extranet that is more for basic information for the end user or basic trainings, retraining for the end user, and the hotlines as I already mentioned. Next slide, please. In terms of lifespan and decommissioning, the lifespan of the unit is about 10 years. However, our first units installed more than 10 years ago are still running because they are still maintained well and they're still in good conditions. The decommissioning will be, however, done by our local partners or by our Tesalis team, so by us. The unit is made of e-waste and metal waste, so the unit can be also recycled as well. However, for that, it is better to contact the local partner who has a bigger knowledge in terms of local regulations for the decommissioning and recycling of the units. Next slide, please. I think this is it for my presentation. So you have the contact details and the name of each sales manager per area, and Mikel Lozano, President and CEO, and myself on the top. Thank you.
Thank you very much.
Thank you very much, Benjamin, Mikel from Tesalis, and thank you to all the LTA holders for participating and sharing about operations and maintenance of your technologies. We have responded to all Q&A questions offline, and just want to clarify that all of the presentation slides and additional resources will be shared following the webinar. So you will have the chance to reach out to all manufacturers if you have further follow-ups. Now, over to Ranjit to give a recap and discuss upcoming activities.
Thanks a lot, Sophie. In the interest of time, you already did mention, Sophie will be sharing all the presentations and the video recording of the sessions. May I call Ridwan, my colleague Ridwan from IAPRO, to give a quick overview of what's coming next on waste management. Ridwan, over to you.
Yeah, thanks, Ranjit. So, for colleagues, I think this is the last technical series for webinar, but we will follow up with some various initiatives as mentioned by Mwenge. It's not only about the equipment, it's also about capacity building about the people. So this is new technology, so we're trying to also engage in human resource capacity building in various levels. This is and there are few activities coming up this year. There will probably another, as I mentioned, all the guidelines, all the technical recording and everything will be uploaded into the TechNet. We are also preparing on webinars and all of guidelines on how to choose the right technology. Of course, there are different types of technology, so it should be fit to the country context. It should be fit to the different type of health facilities and on various local context. So that will be also important for people to understand about that. We also probably in discussion with Mongolia to have the training on the technical capacity training on the maintenance and repair on the green on this type of equipment. We're still under discussions. This is possibly in September. So colleagues, I think if we are interested to study more, to learn more about this new technology, this is a good opportunity. I put you the dates on that, just for people to put it in mind. We'll probably follow up with various more detailed information later on. As I mentioned, we're also going to publish various guidelines. This is including the technical guidance on the technology itself, how to choose, how to select the equipment, and also as you might aware that all those manufacturers presented here is currently have an LTA with UNICEF. So countries who are interested to procure this type of technology can fast track the procurement services to our LTA services. And of course, it's also very important to understand especially for country offices or UNICEF or UNICEF partners on how to use this LTA to accelerate the procurement. I think that's it for me. Thank you. Hand it over to you again, Sophie. Over.
Thank you very much, Ridwan. And back to Alex.
Thank you very much. So TechNet would like to thank GAVI and UNICEF for the organization of this webinar series. We're happy to host another one anytime you want. And for TechNet, this session can be closed. Perhaps if you want to give a last word, Sophie?
only to say thank you to all of the participants, to all of the panelists, and we look forward to sharing more information on healthcare waste management, technologies, capacity strengthening, and all of the different tools and resources that you may have access to. Thank you very much.
Thank you very much. So we can close this session and this series, and we will send you all the materials by email. Thank you, and have a nice rest of the day, everyone.
Thank you very much. Bye-bye.
Bye-bye.